These are the Erector Spinae muscles, sometimes called the paraspinals. You have three groups of muscles on either side of the spinal column. So their job is to, as they say, the Erector Spinae, they keep the spine erect. So they extend the spine when they fully contract. To assess the tension in the Erector Spinae muscles, with the client sitting, and then it's just allowing them their head to go forward, just encouraging them to go into a forward bend, and we're looking for the shape that their back adopts. So you can see here we've got a nice curve, so the vertebrae are made of 24 movable vertebrae, so each one should move a little bit. If they do, you get a nice perfect curve. When they are a little bit tight, when the muscles either side are tight, you get a flatter area. So you can see in this region of the back, the lumbar region, it's flatter than the thoracic region. And when you get to the top here, you've got a slight discontinuity between the cervical vertebra and the thoracic vertebra. So where you see this point here is called a hinge point. So all of the movement is taking place around one area. So we're going to treat this part of the neck in a later video. We're going to concentrate on this lower part here to see whether we can get a bit more movement into the lumbar spine. So we're going to start with, as we always do, with a courage. Up to the centre of the back, palms of the hands either side, right up to the top. Use the heels of your hands. And to directly target the muscles on either side of the spine, just feel for where the spinous processes are. One thumb on one side, one thumb on the other side, fingers pointing away from you, and just slide your thumbs towards each other. And as you're doing it, just jump across, and you should see the tissues either side of the spine forming an S shape, which gives this particular technique its name, spinal S's. So applying the pressure as your thumbs move towards each other, lightening up as they jump across. All the way up to the top. Keeping the movement going. All the way back down again. Just targeting the Erector Spinae muscles either side of the spine. You can also work from the top of the couch, so working along the edge, cross your thumbs to support each other, hook your fingers in and slide down. So leaving your fingers in contact with the spine to give you more control. Arms nice and straight, slide all the way down, right the way till you reach the sacrum. You can do a similar technique working either side. So if you want to work laterally into these, same starting position, but this time we're going to just push our thumbs outwards. Move down, push our thumbs outwards. So try to get above your thumbs. So the pads of your thumbs come up against the spinous processes of the vertebra, and you just move them laterally in a scissors-like action, all the way down. Where you've seen a flat area, so on Andy this was the flat area, so we're going to work this area in a little bit more detail. Pads of the fingers, just feel where those spinous processes are, just go on the other side, into the hollow and push in. So we're not sliding over the muscles, so just sink your fingers in and then take the muscles with you. So avoid flipping over the muscles. That's what we're trying to avoid. Just go down, you'll see it's not a big movement. So you do this in flat areas of the back. So we're going to do that on this side. We also want to work the outside edge. So standing on this side, we're going to come this way. Feel the swell of the muscle. So there's the transverse processes over the edge of the muscle, and this time working in the edge, working towards the spine. So I'm working on the edge of the erector spinae muscles, not pushing with my hands, just leaning with my body, working this lateral edge of this side. And I want to do the same two techniques on the other side. So staying in contact, this time working from the inside edge, pushing those erector spinae muscles away, not flipping over them. And the same. So to find that lateral edge, just feel there, over the edge, and pushing in. Pushing in. All the way. A little bit of effleurage to finish off. And when you finish the treatment, don't forget to retest.